Dear audiences, we are gonna try to talk about sinusitis in this video. What is sinusitis? Let's define it first. Sinusitis is the infection of sinuses. What's sinus? Sinus means emptiness. And in medical term, in this sinusitis, we use sinus as the emptiness in our head between our bones behind of our nose. So the biggest is the maxillar sinus, and the most infected sinus is maxillar sinus. So what does a sinus do? They produce a mucus which moisture the air we breathe, and also hold the particles which enters into our respiratory system. Also, we think it helps to reduce the head's weightness, and we have we believe that there are a lot of more useful of sinuses, but we are still trying to discover it. So when we get sinus infection, usually after a long flu or having a cold, we might get sinusitis if we don't have a treatment well. So what happens when we have a sinusitis infection? We usually have headache. The most common symptom is headache, and when we move forward, it usually increase. And when doctor press the forehead, the pain increases. This is the most common symptom. Besides this, we might have nose bleeding and some fever, especially at bacterial infections, and some like fullness feeling in our ears, and some decreasing of smelling feeling. What does our doctor do when he or she examines us? On the examination, doctor sees may see a postnasal flow. As we told, sinus produce some mucus, and if mucus can't go from our nose, it can go from back of nose to the throat, and doctor can see it. And also when he or she press the forehead or these parts of our head, the pain might increase, and that show we might have these sinuses or forehead sinus, maxillar sinus, and frontal sinus infection. So the doctors usually prescribe if they diagnose us sinusitis. They usually prescribe antibiotics if it's a must, because some sinusitis may be virotic, and we don't normally use antibiotics at viral infections. So please get your examination first, and do your doctor's treatment. And if they don't tell you a time, a length of antibiotic therapy, you must use it at least like 10 days. Maybe some patients need to use like 14 days, some may need like 20 days. It's up to the situation of the patient, and the doctor decides it. So if you cut the antibiotic therapy earlier, very earlier, you may have the sinusitis again. It may repeat because the bacteria won't die if you stop the treatment before they totally die. And what happens? What else doctor can prescribe? Doctor can prescribe some decongestion nasal sprays. It will help you resolve the infection, but please be aware you shouldn't use these nasal sprays more than 5 days, because if you use it more than 5 days, it might happen. It might happen not. It might happen that your sinuses may not work well. So please be aware of this, and this length may change in children. So please follow your doctor's instructions. And what else he can prescribe? Doctor can also prescribe some cold tablets, some cold medicines that would help you to feel much better. And you can use some salty water on your nose. You can manage it by yourself. It will also help you to resolve the infection. Okay, what happens if we don't if we don't get treated well? What are the complications of this infection? The most dangerous complication of this infection could be brain abscess. How this happens? If the infection in sinuses doesn't get resolved, the bacteria could make it like an abscess, and this abscess can spread to the brain, and that will be life threatening, and you might need a brain surgery, and so it will be very serious, and you might get very long term antibiotic therapy. So please be aware of your symptoms and check yourself and go to your doctor and do whatever your doctor says appropriately, and we believe you are gonna live much healthier and happier.